Hello, my name is Julia Robson. I'm smoking cessation consultant for the London Tobacco Alliance. This presentation is on nicotine pouches, snus and heat-not-burn smokeless tobacco products. This session will cover what they are, how they work, how many people in the UK use them, what the health impacts are they recommended for smoking cessation, how are they regulated, and some further information. Okay, coming on to nicotine pouches. What are they and how do they work? They're small pouches that are placed between the lip and the gum, and they slowly release nicotine to be absorbed into the bloodstream. They do not contain tobacco. Once they are parked under your lip, you can talk, you can even sing with them in. They're quite discreet and they're easier to conceal than vaping or smoking. It's suggested they stay in place for up to 15 minutes. They come in a variety of flavours, usually in a little round tin, little round container. The strength of the nicotine in them ranges from about 1.5 milligrams to 30 milligrams. However, products illegally have been sold for 100 milligrams plus, and they've been found on sale. So huge variation there. And in comparison, a cigarette will contain between 10 and 12 milligrams of nicotine on average. Note the absorption of nicotine does vary considerably by the dose, the delivery product, and the product used. So how many people use them and how are they regulated? Well, pouch use is actually rare in current use. Around 1.1% of adults use them, 6% have tried them. However, use is on the rise, and there's lots more talk about them at the moment in social media and so on, especially with young adults. So between 2023 and 2025, usage amongst the 18 to 34-year-olds rose from 1.2% to 2.6%. Now, young men are 3 times more likely to use them than women. Nearly 4% of 11 to 17-year-olds say they have tried them. So that's about 210,000 children. Regulation. Well, these are not regulated well in the UK. They're not covered by the age of sale restrictions. That said, the tobacco and smoking bill that's coming hopefully soon aims to address this. However, marketing experts are really concerned that nicotine pouches are really being positioned at the moment as trendy lifestyle brands and being promoted particularly to young people. So what are the health effects and can they be used for smoking cessation? Well, research is limited. They are a relatively new product. The recent Cochrane systematic review of existing evidence found reduced exposure to harmful chemicals compared to smoking, as one would expect. Some pouches, however, use synthetic nicotine. Others have nicotine derived from tobacco, and that raises concerns about the toxicological relevant contaminants in them, some mouthfuls there. While nicotine is not linked to oral disease like cancer, long-term use can cause issues like mouth ulcers and gum recession, as some dentists are reporting. So smoking cessation. Now, these are not currently recommended by NICE for smoking cessation, and a recent Cochrane systematic review found no clear evidence that they can help smoking cessation, although there was only 4 studies. The NCSCT is producing a briefing with guidance on oral nicotine pouches and the use of these in the new year, so do look out for that one. Moving on to snus versus nicotine pouches. So what is snus and how does it work? Well, like nicotine pouches, the tobacco is in discrete pouches that are placed under the lip next to the gum. As I said, this is tobacco. Tobacco is slowly released into the bloodstream. They do contain nicotine. They come in various flavours, traditionally a sort of more earthy flavour like bergamot, apparently. Snus delivers high, steady nicotine levels. It's smoke and vapour free. It can apparently feel moist. Nicotine pouches tend to be a bit drier, but it does vary by the brand. The shelf life and storage, well, snus needs refrigeration, whilst nicotine pouches don't. Snus is particularly tied to cultural use in Sweden. So coming on to the health risks, smoking cessation and regulation of snus. It is seen as a healthier alternative to cigarettes, particularly in Scandinavian countries. Although it has a lower level of cardiovascular risk compared to cigarettes, the risks are still present. It is tobacco. Prolonged use can cause receded gums, tooth decay, and gum disease. Many of the same health risks associated with tobacco use are evident with snus. The overwhelming benefit, however, is that it doesn't seem to affect lung capacity or function. Now, the tobacco in snus may stain the teeth, the nicotine pouches would rarely do this. So cessation. Studies in Sweden have shown that many people have used snus to quit smoking. However, other studies have also shown that early uptake of snus could lead to a lifetime of being a smoker. Regulation, well, sale is illegal in the UK and marketing of snus is banned in the UK. Slide here particularly on nicotine pouches and snus because the two are commonly confused. So snus is loose tobacco in pouches that are placed in the mouth. Its sale is illegal in the UK and marketing snus is banned in the UK. Nicotine pouches do not contain tobacco. They are sold legally in the UK, but not subject to age restrictions yet, and they are probably less harmful than snus. Okay, moving on to heat not burn or smokeless tobacco products. What are they and how do they work? Well, they're electronic devices that, unlike nicotine vaping products, do contain tobacco. The device looks like a vaping product in which a tobacco stick is fitted. The tobacco is heated to a high temperature, but it is not set alight. It is not combusted. The tobacco is sort of cooked and it may char. There's no smoke created, but there are toxic chemicals released into the vapor that is produced. So they contain nicotine, they contain additives, and they're often flavored. The health effects and how people use them. There's no current direct evidence that they are less harmful than traditional cigarettes. They are more harmful than nicotine vaping products. There are strong associations associated with some cancers, heart disease, stroke, and adverse perinatal outcomes. Some chemicals are found in heat not burn products in higher amounts than traditional cigarettes, and there is some evidence of toxic chemicals in them that are not found in traditional cigarettes. Studies have found no health improvements in the lungs of people who smoke who've switched to heated tobacco, and the reduced risk claims are misleading. So use of them. In 2024, ASH survey showed 2.6% of adults have ever tried them, with 0.9% currently using them. Current use has, however, more than doubled amongst people who smoke, from 1.5% in 2020 to 3.5% in 2024. And unfortunately, amongst young people, 16 to 19-year-olds, the past 30-day use trebled from 0.6% in 2018 to 1.7% in 2023. So are they recommended for smoking cessation and how are they regulated? Well, there is no current evidence that switching to a heated tobacco product will help people quit cigarette smoking. They are covered by the Tobacco and Related Products Regulations, TRPR 2016, and they are subject to duty and taxation in the UK. They must comply with health warnings and advertising restrictions, and it is illegal to sell them to under 18s. The government is intending to ban their promotion through the upcoming Tobacco and Vapes Bill, so we wait to see. The smoking ban does not apply to them, however, as they are not smoked. In 2017, the UK government classified the heat not burns into three categories. First, processed tobacco designed to be heated in a vapour. Secondly, processed tobacco designed to be heated in a vaporizer. And three, devices that produce a vapour from non-tobacco sources, where the vapour is passed over processed tobacco to flavour the hybrids. Could well be quite tricky to work out which category of the product one is looking at, however. So a list of resources here from ASH briefings, ASH evidence into practice, summaries of the health effects of nicotine, some NCSET resources too, and briefings on nicotine pouches coming. So also included the Department of Health clear deep dive on niche tobacco products, which is a helpful starting point if one's considering how to develop an evidence-based and locally appropriate response to these products. So in summary, the use of these niche tobacco and nicotine products is rare. However, it is certainly rising over recent years, and notably with younger adults and teenagers. Oral nicotine pouches, can be confused with snus, which is tobacco, not just the nicotine. Using nicotine pouches is likely to be less harmful than smoking tobacco or using oral or smokeless tobacco. Regulation of oral nicotine pouches is, however, limited, and there is currently no age of sale restriction. Thank you very much.